Ziploc containers as I did in the past. So the next thing I kind of wanted to talk about is TRT and cardiac health. And so this kind of came up because some of my patients are really, they're fans of bodybuilding, right? And I don't know if some of you have followed, what is it? Some of you have followed what has occurred recently with some of the more high-profile bodybuilders. There's an individual, Sean Roden, this guy right here, who died of a heart attack just a few days ago. He's only 46 years old. He's a really prominent Mr. Olympia bodybuilder. George Peterson, also a really prominent IFBB pro bodybuilder, died, I think, a couple of weeks ago of a heart attack. John Meadows, really great guy. He's a really awesome trainer and gave out a lot of information on exercise training, and died, and also passed away, not from a heart attack, but from what appears to be a pulmonary embolism, the cardiac complications. And Kylie Muscle, another bodybuilder that's pretty popular, actually recently had a heart attack, right? And so this kind of led one of my patients to say, well, hey, you know, these guys are dropping like flies. Is that going to be a concern for me with TRT? Well, you know, we'll talk into a little bit as to what I think was the real reason these individuals passed away, but let's just talk about the evidence regarding TRT and cardiac complications. So the evidence is suggesting overwhelmingly appropriately dosed TRT is very unlikely to cause cardiac complications, okay? One of the more prominent urologists in the field that's been studying TRT for many, many years, Abraham Morgenthaler, he's associated with Boston Men's Health, and he's in Harvard Medical School, wrote this review article back in 2015 indicating that he looked at several of the articles looking at testosterone replacement therapy and its effect on cardiovascular disease. And his overall conclusion was that there was no scientific basis for assertions of increased CV risk. And it appears that there's been a pretty good safety profile in the literature for over 30 years, right? And the reality seems to align pretty close to what Dr. Morgenthaler has mentioned. There have been several studies afterwards. So I know with transgender patients, it's becoming more popular. This was a recent article published in 2019 looking at vascular health and cardiovascular disease in transgender adults. What was interesting here is current research about vascular outcomes in adults receiving hormone therapy showed that the use of estrogens in transgender females conferred an increased risk of myocardial infarction and ischemic stroke. Conversely, transgendered males receiving testosterone lack any consistent or convincing evidence of increased risk of cardiovascular or cerebrovascular disease. So these individuals that are transitioning from female to male with fairly high doses of testosterone, you know, TRT doses for a female, of course, it does not appear to cause any increased risk of cardiovascular or cerebrovascular disease so far, which is kind of interesting. And then there's certainly been some studies that have linked low testosterone levels with coronary artery disease. And this is a study that looked at 129 patients that were referred because of symptoms with coronary artery disease. 119 had proven coronary artery disease. And what they found was patients had significantly lower levels of testosterone in the control group, the patients that had coronary artery disease. In addition, their bioavailable testosterone and estrogen levels were lower in patients, in those patients compared to the control group, right? The control group is a healthy group of matched patients outside of the coronary artery disease in terms of age. And then the last article I have here is testosterone is negatively associated with severity of coronary atherosclerosis. And then, so this study looked at a group of 800 men who went elective coronary angiography. And what they found was, I'm going to pull this up right here. The severity of coronary artery disease was shown to be significantly lower in the third tertile. So in the patients that had the highest levels of testosterone, they tended to have the lowest severity of coronary artery disease versus the patients who are in the first tertile who had the lowest level of testosterone, they tend to have the highest severity of coronary artery disease. So there's been several studies indicating that appropriately dosed TRT is likely to be helpful in terms of preventing cardiac complications. Now, I mentioned appropriately dosed TRT. Now, that's where I'm going to get to my discussion on these individuals. So Sean Roden, I mean, he looks like a comic book character. He looks ridiculous, right? The main reason, my personal thought as to why these individuals passed away was not so much because of testosterone, but more so because they had a tremendous amount of muscle on their frame, and their heart had to pump and push a tremendous amount of blood flow to like a huge amount of weight. Sean Roden, I think, was like 5'10" or 5'11", and if you follow his Instagram, I think he was close to 260, 270 pounds, and he was entering a growth phase. So he's planning to get much larger. And that was a few months prior to his death. So, and, you know, this is just from my experience competing as well as talking to coaches. Typically, when a bodybuilder talks about being in the growth phase, they tend to use very high supraphysiologic doses of testosterone, and I'm sure that Sean was. And unfortunately, it seems his heart just gave out because, you know, there's a limited amount that it can do, and I suppose he was trying to push it to the limit. And I guess he developed ischemic stress and suffered a heart attack. The same is probably true for George Peterson, and as well as Colleen Muscle. And then John Meadows, you know, if you're ever curious as to his thoughts on his heart attack, his case is kind of interesting because he suffered a heart attack, I believe it was in early 2020, right? And he had a lot of videos describing his thoughts as to why it occurred. He's very upfront about his anabolic steroid abuse along with growth hormone usage. He thinks it was a combination of the two that might have been linked to that. And then, of course, he had a genetic disorder that predisposed him to clot formation too. So, you know, in his case, it certainly could have impacted it. His genetic disorder may have led to the clots as well, but, you know, he readily admits that higher amounts of testosterone, supraphysiologic doses, probably worsened or increases likelihood of developing heart disease and potentially getting his PE. And then Colleen Muscle, I'm assuming, again, another individual just has a tremendous amount of muscle mass on a small frame. And, you know, just if you have a tremendous amount of muscle mass, your heart is pumping overtime. If there's a tremendous amount of stress on the left ventricle, and you're much more likely to get ischemia, where basically you can't have enough oxygen flow to the heart. It's just pumping too hard. It's using too much energy. And then, of course, you develop a myocardial infarction or a heart attack. Okay, so I talked quite a bit today. I guess I'm going to go ahead and just open up the floor to any questions. Hopefully this